Hi everyone, welcome back. This is Miri, a licensed occupational therapist here on the OT Miri YouTube channel. And wow, it's been a really long time since I've made a video. As many of you know, since my last announcement, I am currently pregnant and taking a short break to do more self-care. And I'm 36 weeks pregnant. It seems like just yesterday when I found out, but I'm already in my third trimester. And I'm sharing this because although I said that I'm going to go on a short break, I've been experiencing symptoms that reminded me of a time when I was studying for the board exam. And it reminded me that nothing we learn during the exam or as a student in occupational therapy is in vain. These things will all come back to serve us and our patients well, and the more you know, the more you can help your patients in a meaningful way. And in my case, I have been helping myself. So it's been interesting, uncomfortable, but I wanted to share this journey with you. So the topic of our video today is carpal tunnel syndrome. It's basically a compression of the median nerve on the volar or palmar surface of your wrist. And what do we know about the median nerve? We've covered this in a lot of my other upper hand and extremity condition. The median nerve distribution runs through the thumb, the index finger, the middle finger, as well as the radial half of the ring finger, right? And so that's where you'll see the signs and the symptoms of a median nerve compression in the carpal tunnel syndrome. It's basically an increase of pressure in the carpal tunnel, and the cause is mainly idiopathic, which makes prevention really difficult for carpal tunnel syndrome. But some of the known factors are things like edema or trauma to the wrist. It could be repetition, and so repetitive motion or movement of the wrist, such as like forceful gripping or being on the computer too long, whatever it may be, repetition, vibration can also cause that pressure, and any conditions or diseases that may contribute to fluid retention or inflammation, which include obesity, diabetes, rheumatoid arthritis, autoimmune conditions like hypothyroidism, and in my case, I suspect pregnancy, because pregnancy can also result in increased fluid retention and edema, and a lot of women in their third trimester, which is where I am, and have these signs and symptoms are diagnosed with carpal tunnel syndrome. And with my 50-pound weight gain, oh my goodness, 50 pounds, I have been experiencing a lot of fluid retention. So pregnancy is another risk factor. So each night, I've been waking up in the last couple of weeks, like vigorously shaking my hand because of numbness and tingling. A lot of people will also express that as pins and needles. And numbness and tingling, what's another word for it? Paresthesia, right? And so with carpal tunnel syndrome, it's typically nightly paresthesia when you're sleeping at night. It may be because of all the daily things that you did that have exacerbated through repetition of the wrist motion, or it could be because of the awkward or poor posture when you're sleeping, such as side lying, something that I've been doing because I can't sleep on my back or on my distended belly. I'm sleeping on my side, and who knows what position my wrists are in, further exacerbating the symptoms. So again, every night I've been waking up with pain, numbness, tingling to my hand. I try to shake it off. But it's been keeping me up at night. It's been quite frustrating. So those are some of the signs and symptoms, and these are usually signs of a mild carpal tunnel syndrome. As we get more moderate, you may also see weakness, muscle weakness, so that may translate to clumsiness in your day-to-day life, so like dropping things or difficulty with fine motor activities like buttoning up your shirt. And for more chronic median nerve compression or advanced carpal tunnel syndrome, you may also see muscle atrophy here in the thenar eminence. So those are some signs and symptoms. And as for testing to see whether or not you may have carpal tunnel syndrome, there are 3 things that you can do, and I've been doing this at home by myself. I wake up in the middle of the night, my husband's sleeping, I have nothing to do, and I'm sitting there like tapping my wrist. Do I have carpal tunnel syndrome? But all of these 3 tests that I'm about to go over, I'll just go over it really quickly. Just an overview, is designed to replicate or elicit signs and symptoms of carpal tunnel like numbness and tingling. And if you do get it, then that means you're testing positive. And of course, we know that positive doesn't mean good. In this case, when you're testing positive, it may be that you do have carpal tunnel syndrome. So the first one, Tinel sign. Tinel, T, tapping. This is where you tap over the carpal tunnel, and you just hold out your hand like this, tap, 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 tap. And if you feel numbness or tingling or that shooting pain, that radiating electric sensation, then you're testing positive for the Tinel sign. There is also the Durkan's test. This is a variation of the Tinel sign, but instead of tapping, in this case, you'd hold out your hand, and with 2 thumbs, you would press down. So you're just compressing that nerve, and you would hold it for about 30 seconds and see if you can elicit the signs like numbness or tingling. And if you do, then you are testing positive for the Durkan's test. Okay, now the third and the final test we're going to talk about is the Valence test, also known as the Valence maneuver. And this is pretty much a flexed wrist test, because what you're doing is you're allowing your wrist to fall into maximum flexion, as you see here in this image. You would hold it in this position and push the dorsal surface of your hands together and hold it in this position for about 30 seconds to about a minute. Now, what this position will do is it'll increase the pressure in your carpal tunnel, which in effect is compressing the median nerve between the transverse carpal ligament. And what you're trying to see and elicit is that numbness and tingling, just like the other 2 tests. And if you do, then you are testing positive for the Valence maneuver test. Okay, so the Tinel sign, the Durkan's test, the compression test, and the Valence test, okay? So those are some of the tests that you can do. Treatment options. So icing, that's something that I've been doing a lot. I've been icing my hand, and as occupational therapists, we know how important activity modification is, right? And so we want to make sure that we're getting plenty of rest and that we're not engaging in repetitive motion of the wrist, that we are not doing a lot of like forceful gripping. And so modifying our activity, maybe even adjusting and modifying our workstation to make it more ergonomic. So those are some of the things that we want to start with. But one of the conservative treatments that we start with, particularly for mild carpal tunnel syndrome, is use of orthosis. And so we want to make sure that we keep our wrist in neutral. Studies have shown that extreme extension or flexion could increase that pressure inside the carpal tunnel. And so we want to make sure that we keep our wrist nice and neutral. Another thing to note about splint is that it's worn at night mostly, because again, as I mentioned earlier, we want to keep it neutral, our wrist, and not put it in awkward, weird positions, side-like positions that can further exacerbate the symptom. And so because it's worn mostly nightly and you take it off during the day, you want to make sure, or you may want to consider, that it's not something that's so hard or rigid, but semi-flexible and soft for comfort. And splinting may also be accompanied with cortisone injection to reduce inflammation. And speaking of medication, I wanted to talk about 2 modalities, the iontophoresis and the phonophoresis. Now, before I talk about each of them, and if you want more information on how these modalities are used, I don't want to go too much into it here because then that's beyond the scope of this video. But I do want to mention that one easy way to remember this is through the word phoresis, which is contained in both of these words, iontophoresis and phonophoresis, because phoresis means transmission. So for both of these treatment options, we are transmitting or enhancing the delivery of topically applied medication. The difference between iontophoresis and phonophoresis is that iontophoresis is using an electrical current to deliver the medication versus the phonophoresis, which is using a ultrasound waves to deliver the topically applied medication. And in both of these cases, whether you are using the phonophoresis or the iontophoresis, the purpose is to enhance the delivery of topical medication or the absorption of topically applied medication, one of which is the dexamethasone. It's one of the more commonly used drugs for these modalities because of its anti-inflammatory properties. And because you're using medication, you would want to make sure that you are aware of the patient's medication allergies and all the contraindications, one of which is being pregnant. So in my case, I'm doing a lot of icing and activity modification, and I haven't gotten a splint yet. That's something that I'm considering, or I will be getting. But know your contraindications before you start using these treatment options. Okay, so those are some of the common treatment options: rest, splinting, activity modification, iontophoresis, phonophoresis, and just basic icing. Now, as you are progressing and you don't have as much inflammation or pain and all of that is controlled, you can begin to do some exercises. You begin the exercise phase of intervention and specific strengthening exercises. You may do nerve gliding exercises, and resistance training should be introduced very slowly to make sure that you don't further exacerbate the area. But again, any sort of exercise phase of intervention should come after the pain and inflammation has been controlled. Now, we just talked about some of the conservative treatment options, but for more chronic carpal tunnel syndrome, your doctor may recommend the carpal tunnel release, and this is basically when you cut the ligament that goes over the carpal tunnel, the transverse ligament, to make more space for the tendons and the median nerve to pass so that there's not as much pressure. This is in gross over a simplification of the surgery, but just to know that there is a surgical option for more advanced CTS, and one of the common complaints that you may hear is pillar pain, which may be on the side, on both sides of the release side, or on either side of the release side, and it may make it difficult for patients to grasp objects afterwards. But some of the post-operative therapy or rehab you can do is immediately want to control edema through retrograde massage or compression gloves or elevation, but after that you would want to begin to do active range of motion, nerve and tendon gliding exercises, as well as sensory re-education, and then you would begin to do strengthening exercises as well. So those are some of the treatment options. And what else is there? I think that's it. So I hope this video was helpful. Again, I just wanted to make a quick video to talk about not only my pregnancy journey, but what's been happening with this hand and carpal tunnel, because what we learn in school and what we learn while we prepare for the board should never be taken as something that's so dreadful. I know that it's hard when you are stressed and when you don't have enough time, but it really is a meaningful and can be a meaningful journey when you remember that everything you learn will come back one day to serve you and your patients better. So I hope you stay encouraged and confident, knowing that one day you will be a very competent practitioner making great impact in your client and patients' lives. Alright, that's it for today. I'll see you guys again next time, and next time maybe with a little infant screaming in the background. I have no idea how I'm going to continue to do these videos, but we'll see, one day at a time. Bye everyone.